Good morning, one and all. Dr. Z here, welcoming you to this week's episode of the one and only Tooth Teacher Tuesday. Today, tackling a very, very common question, and one that is considered, I suppose you could say, controversial or misunderstood. And we've talked in the past about other such subjects like, mercury and silver fillings and fluoride, and some of the concern by the public at large about these types of things. Probably the third thing in the dental trifecta of major concerns of patients is dental x-rays. And so it's a very common question for us as dentists to get asked the question, why do I need x-rays? Do I really need them? What's the point? And so I want to it's a broad topic, but I want to give a pretty simplified answer to that question, especially following up on our recent video talking about the ADA's guidelines with the protective lead aprons. We kind of talked about in that video how dental x-rays have come a long way, especially in the last decade or so, of minimizing the amount of radiation that it takes to get good quality dental x-rays, which I think is where a lot of patient fear and concern comes from. So from that aspect, we've already kind of covered that, but I think another reason for questioning why we need x-rays is not just fear of radiation, but also just understanding what benefit comes from dental x-rays. And so I guess the best analogy I can use is you kind of think of, let's say you're doing some reckless activity and you fall and you notice that your arm hurts, like really hurts. Do you know if your arm's broken or not? Maybe, if it's bad enough of a break, sure. But could it just be a sprained ankle, a sprained wrist, or something broken? You're not going to know for sure unless you get it x-rayed. Same thing with your teeth. There can be a lot of reasons for your teeth to hurt. Could be cavities, could be a cracked tooth, could be recession, could be something as simple as your sinuses are full and they're creating pressure on your teeth. A lot of reasons for teeth to hurt, and sometimes we can identify those reasons with our own two eyes. Sometimes we need those dental x-rays to see what's causing pain. And so that'd be one reason to get dental x-rays, but now you're probably asking, well, I don't have any teeth hurting. Why do I have x-rays every so often when I go for a checkup? And that's more just for prevention, to look for anything that could become an issue, could become a toothache down the road. Scan and preview and screen for any cavities or other issues. Another analogy I could use is that trying to accurately diagnose the entire oral cavity just with the naked eye would be like trying to look at an entire room from the outside but looking only through the keyhole. Sure, you can see parts of the room through that keyhole, but it's going to be a very narrow view and you're not going to be able to see everything. And x-rays allow us to get that extra view, to open that door so we can see the whole room, so to speak. And that's basically why we get dental x-rays, is to see what can't be seen with the human eye. And of course there's also different types of x-rays. Typically the x-rays you'll get every so often at your cleanings are going to be what we call bite wing x-rays, or you might have heard them called cavity x-rays. Those are going to look something like this. And kind of like the name sounds, we use those primarily to look for any cavities. They can also be a good tool for screening to see if there's any bone loss around the teeth. Another x-ray that you should be getting usually about every 5 years or so is what we call a panoramic x-ray, the big machine that goes around your head a couple times. And that's going to look like this. And basically that x-ray is helping us to look for anything, not so much cavities, but more big picture stuff, any kind of pathology in the jaws and the sinuses, along the neck as much as we can see. Yeah, there's lots of things that we can discover from those panos. And in case you're wondering, yes, those are my beautiful x-rays in those pictures. There's other types of x-rays too. The other common one is something called a periapical, where rather than looking at the actual tooth part of the teeth like the bite wing x-rays, periapical is looking more along the roots of the teeth for any kind of pathology there. Specifically, we're usually looking for any kind of infection from a painful or swollen tooth. And then there's also 3D x-rays that are commonly going to be used mostly to look for either cracked teeth, or sometimes used with root canal procedures, or also very commonly used in helping to properly plan out implant cases. And they have other utilizations as well, but that's kind of a broad scope simplified into a 5-10 minute video answer to that big question of why do we get dental x-rays. Again, still not uncommon for patients to be hesitant to get x-rays, either due to fear of radiation or just lack of understanding of why we need them, but hopefully this has kind of cleared up some of that misconception. So as always, please, if you have any questions about anything I've talked about today, please reach out. Otherwise, I look forward to having you tune in on next week's episode of Tooth Teacher Tuesday. Have a great week.